You're listening to Journey Through Aging. For more information about today's topics, log on to JourneyThroughAging.com. That's JourneyThroughAging.com. And now, back to Joel.
Welcome back to the Journey Through Aging radio program. We've come to the middle point of our program this morning. Thanks for tuning in. I really appreciate that. If you like the information you hear on the program, will you tell a friend this week about it? Tell someone about Journey Through Aging. And also, if you've missed some of the past broadcasts because your life is busy and you can't join me every Saturday morning, I want to remind you that our website, www.journeythroughaging.com, has all the past broadcasts there for you. And you can listen to it by week, or you can use the category section on the right-hand side of the web page. And so again, if you would like to learn more about Alzheimer's care and the month that we spent in learning more about Alzheimer's care, you can click on that, and there are several categories that will come up, and each one of those segments is no longer than 14 minutes. It's a great way to hear a program that you've missed or re-listen to something to gain the information that we share here on Journey Through Aging. You know, dental care is vitally important in maintaining good quality of life. For some, when we enter the later stages of life, going to a dentist becomes a lower priority. To provide some insights about why oral health is critical to a person's total well-being, I have on the line dentist Timothy McDuffee from the Oak Creek Dental Care in the northeast Columbus area. Dr. McDuffee, let's explore 3 questions this morning. Why should a person visit a dentist?
Hey, good morning, Joel. It's great to be back. Hey, people on a daily basis take advantage of eating, smiling, chewing, functioning with their teeth, and take advantage of it without even thinking about it. So obviously, as we get older and our physical activities get limited, we want to make sure that the things that we still can enjoy, eating, simple conversation with friends, smiling and enjoying each other, that you're doing the best to take care of all that. So taking regular visits to a dental office so that you can keep abreast of what kind of condition your teeth are in, or if there's any upcoming problems, that's why we find it most important.
Well, in thinking about our senior friends, dentistry has come a long way, and some people may have some anxieties about coming to a dental office. What's a dental visit feel like today? When I grew up, I enjoyed my dental visits, but it has changed a lot. There's a lot of dental anxiety.
Perhaps even some of your listeners have experienced problems in the past, but today what really drives a dental experience to be its best is that we do a lot of co-diagnosis with patients. We tell them everything we're going to do. We let them know how we're approaching their mouth. We talk to them, find out what their concerns are, what their priorities are, and then as we look through their x-rays and take pictures of their mouth, we help them to understand what's going on, what their options are, where we think their priorities are, and let them decide, how much, how fast, how much do you want to do, how much do you want to take care of, and if what we're looking at becomes serious enough, a lot of times there's different options, but it's just important to make sure that you take care of your mouth. Well,
thinking about dental care and the later stages of life, in what ways can a dentist help an aging loved one enjoy life more?
Sure. A lot of our older patients that come in, the things that tipped them off to being problems were, they've started having trouble chewing, or they're avoiding the foods that they enjoy most. It takes them longer to eat, or they're still sitting at the table while everybody else has moved on to dessert or watching TV. Maybe even notice that their breath is bad, or their loved one may be getting a little bit withdrawn, maybe a little bit depressed. Those are all signs that maybe there's some dental disease going on in there. there's some pain with chewing. Maybe they're embarrassed about because a tooth cracked and they don't want to smile. All these things are really, the mouth is a very intimate place, and it really has a huge impact on people's well-being.
One of the things that we also hear a lot about is gum disease, and gum disease seems to be like something concerning older adults more and more, and I think I read about this periodontal procedures, and I'm just wondering if you could help our listeners understand a little bit more about that.
Yeah, well, as we age, of course, the gums, you will get some natural recession, but with periodontal disease, what happens is the bacteria build up. People don't think that they'll get cavities or problems. You know, when they're young, they think that's when you get cavities. But the periodontal disease feeds off the bacteria that build up. The same thing that causes decay causes gum disease, and it's a long-term chronic disease. So you don't feel. It's not like you feel it right away. You don't feel, or a lot of times even see signs or symptoms of it till it's very advanced. More people end up losing their teeth from gum disease than they do from cavities and cracked teeth and accidents and things like that.
And so, and we know, and maybe you can expound a little bit on this, is that there's definitely health connections from good oral health to good well-being, right?
Yeah. Since I've been out of school, over the past 10 years especially, there's just been an explosion of information and research showing that the bacteria that are involved in gum disease relate directly back to plaque in arteries, to higher incidence of stroke, to ulcers. I remember reading a study once where in retirement homes there was a lot higher incidence of pneumonia and lung problems in people that actually had their teeth because of the bacteria and feeding directly into the lungs than people that had dentures had less incidence of lung problems. Now, I'm not saying that we ought to get dentures when you go to a retirement home, but just the importance of taking care of what you have, because it can impact you.
Well, we want to keep our teeth for a lifetime, and one way to do that is obviously to have regular visits with a dentist and explore together where you're at and what the health conditions are and all that. Any final words that you'd like to share with us this morning?
Yes. As people think that they may be having problems or their loved ones are having problems, just explore. Talk to your dental offices and find a way to bring them in, whether it's a simple visit to explore a particular problem or just to have an overall good look so that you can make a plan. Again, a lot of these problems start small. People won't realize it, and by the time we see them, sometimes it's just too late and people start losing teeth, and that can be devastating for people.
Absolutely. The smile is something that we all want to keep, and especially if it's your own teeth, it's something very important. Dr. McDuffie with the Oak Creek Dental Care, we really appreciate you spending some time with us this morning and for providing some insights about dental care.
Joel, thanks again. Really enjoyed it.
Every chapter in life should be an exciting one. If it could be better for you and you have questions on how, email Joel at joel@journeythroughaging.com.
Wellness has become one of the buzzwords in our modern society, and most people think of wellness as the quality or state of being in good health. But what does it take to be in the state of good health? Is it just the absence of disease, or is it something else? Wellness isn't just about eating right and exercising. It's more than that. And here at the Journey Through Aging radio program, we want to focus on the 6 dimensions of aging, and I just want to remind you of what those are. We're talking about whole person wellness, and that's going to include social, building loving and supportive relationships and contributing to a healthy society, intellectual, striving to expand your knowledge and improve your skills. Another dimension is spiritually, searching to create a personal sense of life's meaning and purpose through everyday experiences. Physical, taking care of your body through exercising and eating right. Emotionally, acknowledging and accepting wide ranges in yours and other people's feelings. and vocationally, emphasizing the process of determining and achieving personal and vocational interests. Those are the topics that we like to explore on this program, and if you have questions about those, we would love to have those. And you can send them to me at joel@journeythroughaging.com. The sponsor of this radio program is the Ohio Presbyterian Retirement Services, and they have a newsletter coming out in just a few weeks, and it's called OPRS Living. And it's a wonderful newsletter packed with great information, and it also provides information about events that are happening at our 11 retirement communities. And if you would like to be on the mailing list, you can do that by calling 1-800-686-7800 and ask to be placed on the OPRS Living newsletter database. That's 1-800-686-7800. Well, just after this next commercial break, we're going to learn more about Landfair Retirement Community in Cincinnati, Ohio.
Hey, you've reached Alice. I'm probably out, so if you leave a message, I'll get back to you as soon as I can.
Hey, Grandma, it's Ben. Hoping to see you soon. You know, Mom, since Grandma moved into that retirement community, she's got a busier social life than me.
I know. She's loving it. Hey, we'll see her this weekend, though. We're going over for movie night.
From square dancing and movie night to book nights and girls' mani-pedis, you or your loved one will fit right in at the active Ohio Presbyterian Retirement Communities. Their residential communities of friends and neighbors offer options centered around quality of life, freedom of choice, and spiritual growth. 11 locations in Ohio. Set up a tour today at oprs.org. That's oprs.org. Or call 1-800-686-7800. 1-800-686-7800. The lifestyle you want to live is waiting.